to the Chair for his indulgence. First of all, how does somebody get referred to an orthodontist, a public orthodontist? So what's the referral pathway? Mr. Green, could you answer that for me?
Sure. Child is seen through the dental service run by the HSE, and the HSE dentist assesses whether there's an orthodontic treatment need, and if there is a system called the Modified Index of Treatment Need that's used, and if the dentist assesses the child and leaves the condition or the emerging condition as likely to be accepted for treatment, the referral will be made. Then the assessment is made by the regional orthodontic department. Okay,
but I would imagine if somebody is referred to an orthodontist, they are referred for a good reason. And even if it's for a routine inspection or for a routine treatment, it needs to be done. So I think Ms. Dougal talked earlier about nudging people to make sure that they get treated as quickly as possible. And Ms. Kavanagh spoke earlier as well in a similar vein. So just maybe either to Ms. Dougal or Ms. Kavanagh, if you were referred to an orthodontist, how quickly should you make sure that you get assessed, you get seen, you get your inspection, you get your treatment, whatever is needed? If, for example, you were referred but you left it on the long finger for a couple of months, for 6 months, would that be a wise thing to do?
Sure.
If I could just ask maybe whether Ms. Dougal or Ms. Kavanagh first to respond to that, if in terms of making sure that a person gets either the treatment they need or the inspection is carried out to see what the problem is. If you are referred to an orthodontist, I would assume the referral is made for a good reason. How important is it that that person is seen as quickly as possible, I suppose, is my main question.
Well, with regard, I can speak on behalf of the policy.
Yeah.
I'm not, want to be clear that I'm not speaking on behalf of the service.
Yeah.
And so when we were looking at it with regard to policy and in line with Sláinte Care, yes, the intention would be that assessment would happen as quickly as possible. We've talked quite a lot about advanced care and the importance of specialist care, but one of the key points of Sláinte Care is to ensure that as much as possible can be carried out in the local setting and in a primary care setting. So this is a real key task for the Dental Council, indeed for all secondary care services, but also orthodontics, to look what elements of orthodontics can be appropriately carried out within a primary care setting to speed up that situation. That's the type of service that's provided in other European countries when they do provide orthodontics. And indeed, even in the UK, which has very traditionally been a specialist service, they've now looked at many of their service treatments going out where possible and where appropriate. I'm not for a moment saying the advanced care services, but where possible and appropriate, the Dental Council is going to look at that in conjunction with the Committee for Specialist Training.
And if I can just come back maybe to Mr. Green, because somebody earlier raised clinics where people come to us obviously with a range of different issues and ask us to raise issues of concern to them. Orthodontics sometimes is one of those issues, and I know in the South East more so because the wait times are higher. So I did put a parliamentary question in, which I think you responded to, Mr. Green, around wait times in the South East, and I have to say I was taken aback when I got the response. And it was broken down by year from 2014 to 2019. So for routine treatment wait times for orthodontics across the South East, the average wait time in 2014 was 42 months. The average wait time now is 60 months. And if you look at my own constituency in Waterford, 2014, 37 months, 2015, 47 months, 2016, 51 months, dropped back to 47 months in 2017, possibly because of the national procurement process you spoke about earlier. 2018 back up to 54 months and now 60 months. So how could 60 months be an acceptable wait time?
I don't believe it is. It's not.
And why is it 60 months? What's the problem? How could 60 months, so we're clear, is 5 years? How could that be possible, that somebody has to wait 5 years for an inspection, which I assume is the case? And even then, in terms of delays in calling for priority wait times, it was up to date in 2014 and 15. It then went to 9 months in 2016, 13 months in 2017, 16 months in 2018, 18 months in 2019, a year and a half. for priority cases. I mean, for me, they're astounding figures. So first of all, we talked earlier about policy. We heard a lot about policy. We heard a lot about encouraging people to go and get checked up to make sure that they get the treatment that they need as quickly as possible, nudging people, supporting people, raising awareness. But if the capacity is not there and the services are not there, and for a routine appointment it takes 5 years or 60 months, and for a delay in what's called a priority takes 18 months, makes a mockery of the policy if that's the case. So why is it that people in Waterford, and by extension the South East, because the numbers are very similar, have to wait 60 months for an inspection and 18 months for more serious cases?
Okay.
What's the problem?
The problem is one of capacity. The capacity of the system.
It's capacity for 5 years. So why was it not dealt with over 5 years? If it's going up and up every year, surely the people then who are tasked with making sure that wait times come down are putting the solutions in place. So if something is a problem for that length of time, then the people who are responsible for making sure that the solutions are put in place are obviously not doing it, because they're going up. You've acknowledged that the wait times are going up, not down. So if it's capacity, what capacity specifically? Is it orthodontists?
It's the number of orthodontists, and thankfully there's been some recruitment in the South East. An orthodontist took up duty in April in New Ross. The number of orthodontists be needed there is much higher than is there currently. But as I said earlier in the answer to Deputy Brazel, in order to increase capacity, we either increase the number of specialists or increase the number or introduce the grade of orthodontic therapists and provide the appropriate number. And that's in our workforce planning at the moment, the introduction of the grade of orthodontic therapist.
And see, what's frustrating for me, and I'll finish on this because I know you want to come back in, Caherla. I was here for about an hour and a half, and I thought Miss Cavanagh's responses, Miss Dougal's responses were first class in terms of setting out the policy, setting out a vision, setting out what needs to be done, setting out in very clear terms, but also important terms, what people need to do to look after their own oral health and dental health and so on, and also from others as well here. But it does make a mockery of policy, does it not? If in the South East there's a 60-month waiting list, 60 months, 5 years to see an orthodontist. And then we were up to date in 2014 and 15 for the priority cases, and they would slip back to 18 months. So it's hard to sit here and listen to, you know, all of what's been said about policy when the reality for people is somewhat different, and it is then children who suffer the most. If you're waiting 5 years, and it might be a routine, I would imagine, if it might be, you know, you're referred for a reason, it might be a routine reason, but over 5 years, if it gets worse, that person, as we said earlier, that person is 13, 14 when they're referred, could be 19 before they're seen. It just seems to me to be outrageous, and it's very difficult. You know, I commend the people who are very passionately champions of the policy, but policy is one thing. The implementation of that policy, the outworkings of policy, and what's available for people, in my view, in the South East, seem to be two different things.
Dr. Kavanagh?
Well, I think this highlights exactly why we say there's a need for change and looking towards the other European countries. Technology has changed enormously in dentistry, even in the last 5 years. You only have to walk down the high street to see how many private dentists out on, not when I say private dentists, dentists working in practice who are providing orthodontics. This was undreamt of before. I'm not just talking about orthodontics, I'm talking about implants and other areas. I'm not talking about in the advanced areas. Absolutely, we need our specialists for those areas. But it's very important to see what we can put out reasonably and appropriately and supported by our specialists and by our consultants out into the primary care setting. I'm not just talking about orthodontics, but you're absolutely right. I think that's a very clear example of why we need a new way of looking at features. These these model has worked excellently for us. We have excellent oral health in Ireland, but it is a model that needs to change now. As you say, we just can't keep up. Changes in technology have now allowed us, the facilities, to look at it in a different way. Make sure that where possible, where appropriate, people in Waterford can get access through their local primary dentist with support. And that's key, with support from the specialists and the advanced centres from the community dental services. And this is what we want in the policy. And that's why we're so keen to start, and the advanced centres of care so quickly, so we have those specialists in place, seeing the dimensions of their job, not just about treatment, but about mentoring and about support. But also that primary care dentists have the opportunity, and in consultation, they were adamant, we have the skills, we want to use all of our skills and provide such areas in other areas of secondary care. They just need to have the support for it. It's an urgent piece of work. It's a priority in the policy. We must move forward in that direction. I think we would, yeah, in all of the areas of secondary care, let's move forward with the rest of Europe, and let's take it forward.
And maybe just one final response for Mr. Green in terms of, you've mentioned capacity. There is a capacity problem, and you've said that there has been some additional capacity. And is that additional capacity enough to reduce the wait times? And if it isn't, what more is needed?
What more is needed is a comprehensive workforce plan, not just for the South East, but for the wider orthodontic service. Getting the skill mix, the correct skill mix within that, across consultants, specialists, and orthodontic therapists, as I said, and dental nurses. Can I also say that the staff do a very fine job, and the outcomes from our orthodontic treatment are very good. I think that should be said as well.
Thank you very much. Just